Scooch up. And we're back. The most common eye surgery currently being performed in the U.S. is not the laser refractive surgery. Millions of Americans successfully undergo cataract surgery each year. And here to talk more about this type of eye treatment, Dr. Brent Reed of Griffin Reed Eye Care. Dr. Reed, always nice to have you here on the program. Always have some good eye advice for us, and a lot of people should pay more attention to their eyes than I think we found that they really don't.
That's true.
What about who's eligible for cataract surgery? Most of the time we think of cataracts being with older patients.
Traditionally it is with older patients, Walt, but occasionally you'll find a younger patient with diabetes or who's taken steroids for asthma or some other cause, or maybe just trauma will cause a cataract. All a cataract really is a clouding of the lens inside the eye.
Okay. Now we have the eye model here.
Yes, and if you open this up, we show it to the camera. Inside the eye, the lens, which sits back about a third of the way through the eye, clouds, and as a result, light trying to get into the back where it's actually focused becomes difficult to see. And when we remove a cataract, we simply take the lens out and replace it with a new lens.
I think we have another graphic coming up here, some pictures with different cataract types that we're going to share with folks. Explain that, Doctor.
That's actually a picture of a lens implant implanted from the back side looking forward to show what that looks like through the pupil itself. And there's a number of different ways to implant lenses and different places where the lenses will sit. There's also a couple new lens types that actually sit in the front of the eye that are used for people that want to decrease their dependence on glasses as well. So lenses are no longer just being used for cataract surgery, but also for refractive surgery.
Now, lasers are so popular now. What role do lasers play as far as cataract surgery?
Interestingly, just about every senior that comes in the office that wants cataract surgery wants laser cataract surgery, and it's just not something that happens. It's done actually with a high-frequency sound wave, not a light beam.
Okay.
And most of them don't understand that, but it's very technical, very precise, and works very well.
What about the placing of the lens on the eye now? What does that do for the cataract?
Well, what it does really is it replaces the light bending capacity of the lens that we remove. And it's important to do that. But up till now, the limitation has been that lens would be fixed focused. Most people wanted to see far away with that lens implant. Now some new lenses that are coming out actually will flex and focus as the eye muscle moves, giving potentially older folks the chance, and folks that have cataract surgery, the chance to see up close and far away, just like they did when they were young.
My grandmother Gray had cataract surgery probably in her late 80s and could barely see at that point. I don't recall how it went, but it was some time ago. After that procedure, how well could she have expected to see?
Actually, if the back of the eye back here in the back is healthy, then they can folks can expect to see like they did when they were kids, when they were teenagers.
So it's no longer this problem anymore when you have cataracts. It's this huge surgery, like eye surgery before Vizx came along.
Yeah, exactly.
It's a lot easier with a laser now.
Traditionally, it's a 15 to 20 minute outpatient operation, come and go, very little trauma to the patient.
What about, I mean, we frequently talk about new things coming along that makes things easier, and certainly for the cataract patient, the laser has done that. Anything else?
Some of these new lens implants that we discussed that will actually change the focus length so that they can see up close and far away with the same lens implant. That's one of the big things that's coming this next year, and will be FDA approved and studied further, and then come along for patients' implantation. Also, an ability to place a lens implant that may eliminate or decrease astigmatism at the same time is a big thing that's coming.
Stay with us. We'll be right back with a final check.